morning. We're back for another episode of The Speaking Panda. So, what's the agenda today, sir? I heard we have a special guest with us. So, can you introduce the guest?
Yes, the special guest who is there with me is somebody who is always there by my side, and many of the students and many of my former students, when they come to college or when they come back from a sabbatical or somewhere, they still ask me, sir, do you still carry your drum? So special guest for today is my drum.
Wow.
And you will never ever see me without this drum. It is always there in my hand, and sometimes it is balanced by another bag which is either my surgical saw or my camera bag. So that's my drum.
How long have you been associated with the drum?
I don't know, I think it's now become a integral part of me, like the vibranium shield of Captain America or Tony Stark's heart. So for years together, maybe 2 decades, that's what it is.
So, in a way, using the same metaphor, it is such an integral part of you, like Tony Stark's heart. Your life depends on the drum.
Yes, of course it gets upgraded from time to time, like Tony Stark's heart, and gets a better, shinier avatar, but the core remains the same.
So let's hear it from you now. What is in your drum? What is in Dr. Pushkar Waknis' drum?
So basically, I have this obsession for using my own specific instruments for all my operations. So there are two kinds of surgeons, if I can say so. There are one kinds who are wizards and they can do any surgery with any particular instruments, and there are other kinds who are very specific and they like their own specific set for own specific instruments. So I had a discussion about this a long time back as to which is the right approach. There is no right approach. It's like, Sachin Tendulkar plays with his bat and Rahul Dravid plays with his bat, and if you give Rahul Dravid Tendulkar's bat, he will probably not be able to play with it as well as he would play with his bat. There was an interesting anecdote that Ajit Wadekar, the famous Indian captain, the left-hander, he broke his bat once after scoring 100, and then he wanted a new bat. So Sunil Gavaskar ran out and gave him his bat. So after that, Ajit Wadekar hit 3 consecutive fours and went to 112. And then he got out the next ball. So Sunil Gavaskar in the dressing room said, "I'm sorry, you had to get out because of my bat." He said, "No, those fours were the best I have ever hit in my life." So it's a very individual question, what works for you and what doesn't work for you. I feel comfortable. I feel I can give the best possible results to my patient when I'm using my particular instruments. So whether it's an onco set or an osteotomy set or a cleft lip or a palate set or a minor surgery set. So today we will just talk about the minor surgery set.
Alright.
Once you have this drum, you have to assimilate all the instruments which you are going to need for your minor surgery, and then arrange them in a sequential manner in the drum, so that when you open the drum and arrange the trolley, it will be easier for you. So the way I do it is that all the instruments which are needed for extractions, we put them first. So these are our modified third molar forceps. Of course, this is the bayonet, maxillary molar, and the anterior. A straight elevator or a Coupland's elevator. We use a straight crier and not a crossbar, because the crossbar, in my view, exerts a very large force for the third molars. Apexo elevators, and of course the Warwick James, which is very, very important, especially for the third molars and the root pieces. And in case I want to do some atraumatic extraction, the luxator is always present with me. Once I put this in my drum, the next step is the body drape of the patient, which you neatly fold and place it. Now we place our second set, which is our diagnostic set: a mirror, a tweezer, a probe, a Bart Parker handle, universal scaler, a periosteal elevator. So this is the periosteal elevator. Two mosquito forceps, a curette, a fine tooth forceps, and a fine needle holder, and a scissor to cut the sutures. Two metallic suction cannulas, and this one has got a silicone tip so that the nozzle is smaller and the sucking capacity is more, and three clips or clamps to hold the drape in position, a bite block, a large 20cc syringe for irrigation, a gallipot, gauze, packed and suture. So each packet has got around 12 to 14 gauze pieces for one minor surgery, and this is my backup gauze in case this gauze is insufficient for some reason like bleeding. An Austin Flint retractor, a sleeve for the motor, a surgical handpiece kept in a pouch with two burrs, one as the main burr, the other as the backup burr. Our other handpiece as the backup handpiece in case this forms of midway. A drape for the trolley. And lastly, a gown for the surgeon, especially in terms of COVID 2019. So for COVID 2019, we're seeing a lot of paraphernalia and controversy, PPE, no PPE. So I have a very simple understanding of the virus, and it may be limited in knowledge. But the virus comes in through our mouth and nose. So there is a need for protection of our face, yes. And our street clothes need to be protected with a gown. Now whether is a disposable PPE or not, it depends on an individual. We also have to see the biomedical waste impact which we are generating per patient, per procedure. Now this is a gown which I have been using since a long time, and this is made up of umbrella cloth in the front. So basically this gown was gifted to me in 2005-06 by my friend GSV Prasad in Wardha when I had gone there for a workshop. So this gown has a complete umbrella cloth. So whatever aerosol is going to be generated, it is all going to fall over here. So once you wear this gown like this, everything remains protected. So in COVID 2019 times, I would expect that any minor surgical procedure which we are doing, we should wear a full gown and then do it. If it's a plastic coated or an umbrella cover gown, it's better. If it's not, it's still the same because you are just going to be working for hardly half an hour to 45 minutes. So this gown is now folded and placed on top, and we put the autoclave marking tape inside and outside. Don't forget to open the holes and take this drum, pack it in your autoclave, autoclave it and use it. Remember, there is no option to autoclave. I hope you enjoyed it as much as we like doing it.
Thank you.